This morning, health officials are tracing the contacts of passengers who were on a cruise ship with a deadly virus. Officials in Georgia say they are monitoring 2 American passengers who recently came home, and another is being watched in Arizona. So the ship is now heading toward the Canary Islands in the Atlantic, but it may not be allowed to dock. Tom Hanson is here with the latest. Tom, this saga is a nightmare, ongoing nightmare for these poor people. Good morning to you.
Good morning to you, Gayle. So many developments here. More than 24 passengers who were on the infected ship disembarked nearly 2 weeks after the first passenger died of the deadly virus, according to the ship's operator. Now, meanwhile, health officials in Arizona and Georgia say none of their residents who were on the ship are showing signs of infection. U.S. health officials are monitoring Americans who were aboard the MV Hondius but departed before the ship went into quarantine. The MV Hondius is less than 1 day into a 3 to 4 day journey from Cape Verde to the Canary Islands, and already the plan to get the nearly 150 passengers off the boat is facing pushback. The Tenerife mayor says his island is ill-equipped to handle the aid needed to be administered to the passengers, and warns that allowing the ship to dock could pose a greater health risk for the local population. So far, at least 8 people on board are believed to have been infected with the hantavirus. 3 of those cases have been confirmed, 3 passengers have died, and 1 is in critical condition. And now the Dutch health ministry is reporting a stewardess is in the hospital after showing possible symptoms of hantavirus. She was not on the cruise, but had reportedly been in contact with a woman who died from the virus. Ruhi Jeanette was a passenger on the cruise. He recorded this video of the captain announcing the first death days later.
One of our passengers sadly passed away last night. Tragic as it is, it was due to natural causes, we believe.
Following the captain's announcement, Jeanette said the passengers on board continued with social activities.
He said it was due to natural causes and we are not infectious. This was relaxing at the time, but it was also misguiding us. Because
Clearly so many questions here. Now, Ocean-Wide Expedition, which operates the cruise ship, issued a statement saying in part, at the time of the announcement, no evidence of a virus or contagion was present on the vessel. Now, the State Department told CBS News it is monitoring the situation and is in close contact with the cruise ship and health authorities regarding the status of the American passengers, guys.
Oh, boy, Tom, thank you so much. Medical correspondent Dr. Celine Gounder is here. She's also editor-at-large for public health at KFF Health News. Celine, good to have you here, because this is very frightening for many people who are listening to this. So we just heard about the Dutch stewardess who's hospitalized. What are they doing now to trace contacts from her and other people?
Yeah, so the Department of State from the U.S. perspective is leading our response. As we have heard, about 7 Americans who are on the ship are back in states including 2 in Georgia, 1 in Arizona. The CDC has activated their Emergency Operations Center, which shows that they're taking this seriously, and is sending passenger lists to state and local health departments to track those people down and follow up. If they are quarantining the passengers as they did for us for Ebola, so I was an aid worker in West Africa at the time, I had to quarantine for 3 weeks at home. When I returned, they gave us thermometers, they gave us symptom diaries. We had to call in every day to check in about our symptoms and temperatures. There was no enforcement of the quarantine. It was just honor code, but I did stay at home. And the quarantine in this case would be longer than 3 weeks than for Ebola, because the incubation period for hantavirus is longer. Big picture, if anybody was exposed, they would want to stay, rationally speaking, near a hospital, because if you do start to get worse and develop severe hantavirus disease, you may need ECMO, which is the heart-lung bypass machine, and not every hospital even has that. So you would want to be near that kind of hospital.
When I think about rodents and viruses, my mind goes to the movie Outbreak, which scared the daylights out of me. How worried should we be?
I think big picture, people should understand this is not COVID. I think we all have PTSD from COVID, including a cruise ship with an outbreak. This is not COVID. The mechanism of transmission is different.
All right. Dr. Gounder, thank you.